Imagine if a tiny gland deep within your brain could control how your body responds to stress, manages energy, and even fights inflammation. This isn't science fiction. It's all thanks to a powerful hormone called ACTH, or Adrenocorticotropic Hormone. When something goes wrong with this system, it can affect nearly every part of your body. That's why doctors use the ACTH test to uncover hidden issues in your body's complex hormone network and keep your health on track. At its core, the ACTH test measures the level of adrenocorticotropic hormone in your blood. But what does ACTH actually do? ACTH is a messenger chemical produced by the pituitary gland, a small organ at the base of your brain. Its main job is to tell your adrenal glands, tiny structures sitting atop your kidneys, to produce another crucial hormone called cortisol. Cortisol is sometimes known as the stress hormone. It helps your body respond to stressful situations, but its influence goes much further. It reduces inflammation, controls blood sugar levels, regulates metabolism, the way your body uses food for energy, and maintains healthy blood pressure. In other words, cortisol is essential for many of your body's most important processes. The ACTH test is especially useful because ACTH and cortisol work together in a delicate feedback loop. When your cortisol levels fall too low, your pituitary gland releases more ACTH to tell your adrenal glands to make more cortisol. If cortisol levels get too high, the pituitary gland releases less ACTH, signaling your adrenal glands to slow down cortisol production. This feedback system keeps your hormone levels balanced. But what if something disrupts this system? That's where the ACTH test comes in. This test is a key tool for diagnosing and monitoring conditions that affect your body's ability to produce or regulate cortisol. Some of these conditions involve the pituitary gland, while others affect the adrenal glands themselves. One such condition is Cushing's disease, where a tumor in the pituitary gland produces too much ACTH. This overproduction tells the adrenal glands to make excessive amounts of cortisol, leading to a range of health problems. Another related disorder is Cushing's syndrome, which can result from long-term use of steroid medications, tumors in the adrenal glands, or even tumors elsewhere in the body that create extra ACTH. On the other side of the spectrum, low cortisol levels can be just as serious. Addison's disease is a condition where the adrenal glands are damaged and can't make enough cortisol. This damage is often caused by the body's own immune system attacking the adrenal glands. Another possible cause is hypopituitarism, a rare disorder where the pituitary gland doesn't produce enough hormones, including ACTH, leading to a shortage of cortisol. Doctors may recommend an ACTH test if you show signs and symptoms of abnormal cortisol levels. Too much cortisol might cause weight gain, thin arms and legs, a rounded face, fat buildup around the neck or between the shoulder blades, easy bruising, purple stretch marks on the skin, and muscle weakness. If your body isn't producing enough cortisol, you might feel constantly tired, weak, lose your appetite, lose weight, or experience abdominal pain. Sometimes the ACTH test is used alongside a cortisol test. By comparing the levels of both hormones, doctors can pinpoint where the problem lies, whether it's in the pituitary gland, the adrenal glands, or elsewhere in the body. This information is crucial for making an accurate diagnosis and finding the most effective treatment. The process for the ACTH test is straightforward. A healthcare professional draws a small sample of blood, usually from a vein in your arm. It only takes a few minutes and involves little risk, perhaps a small sting or some temporary bruising at the site of the needle. To get the most accurate results, your doctor may ask you to fast, meaning no food or drink, for several hours before the test. Blood samples are often taken early in the morning when ACTH levels are at their highest. It's also important to let your healthcare provider know about any medications you're taking, as some drugs can affect your hormone levels. Never stop taking your medications unless your doctor instructs you to do so. What do the results mean? High levels of ACTH, especially when paired with high cortisol, may point to conditions like Cushing's disease, where the pituitary gland is overactive. If ACTH is high but cortisol is low, it could mean the adrenal glands are not responding properly. possibly due to Addison's disease or damage to the adrenal glands. Low levels of ACTH and cortisol together might suggest a problem with the pituitary gland, such as hypopituitarism. The ACTH test is a window into your body's hormone regulation system. By revealing how well your pituitary and adrenal glands are working together, this test can help doctors diagnose complex disorders and create a treatment plan that's right for you. In some cases, additional tests may be needed to confirm a diagnosis and rule out other potential causes. Understanding your hormone levels isn't just about solving a medical mystery. It's about gaining insight into how your body manages stress, metabolism, blood pressure, and inflammation, all of which are vital to your overall well-being. In summary, the ACTH test is a powerful tool that helps healthcare providers diagnose and monitor disorders of the pituitary and adrenal glands, identify the cause of abnormal cortisol levels, whether too high or too low, guide treatment plans for conditions like Cushing's disease, Cushing's syndrome, Addison's disease, and hypopituitarism. Ensure your body's delicate hormone balance is maintained for optimal health. If you or someone you know is experiencing symptoms related to abnormal cortisol levels, such as unexplained weight changes, fatigue, or unusual bruising, talk to your doctor. The ACTH test might be the key to unlocking answers about your health, so you can take the next steps toward feeling better and living well. In the intricate world of hormones, balance is everything. The ACTH test shines a light on this hidden network, offering clarity and hope for those seeking answers. With just a small blood sample, you can reveal vital information about how your body works, helping you and your healthcare team make informed choices for a healthier future.